Good afternoon, everyone. My name is Joseph Matty. I'm the president of the JourneyCare Foundation. It is my pleasure to welcome you to our first for 2021 Lunch and Learns. Before we begin with the program, I just want to let you know that today's session will be recorded and it'll be on the JourneyCare Foundation website 24 hours after the conclusion of today's presentation. Also, for those of you who registered via online, we'll be sending you an email response questionnaire. Let us know what your thoughts were of today's program, the panelist discussion, and future topics that you'd like us to consider. And when do you think you'll feel comfortable with seeing each other in person for a lunch and learn? With that being said, for those of you dialing in, I want to once again welcome you to today's lunch and learn. Last year during the pandemic, when it started, virtual events and meetings like this were uncommon. Midway through, we all pivoted and started to host more of these. We started to see the power of connectivity, not only just face-to-face, but virtually. The popularity of this program grew, and so did the topics. Today is the opportunity for us as the JourneyCare Foundation to introduce you to a program that we started at a board level. We started because we heard from our community members, and we started because we had partners and philanthropists that wanted to continue to make a difference in their community. Today, you'll be hearing from our Director of Workforce. You'll be hearing from our 3 community health workers. But more importantly, you're going to hear from the philanthropists that took a chance, that believed in the power of education, community engagement. You'll be hearing from Willard Hunter and the Executive Director of the Hunter Family Foundation, Frank Biaggi. Today's program is a direct result of the JourneyCare Foundation listening and understanding the needs of our community. We cannot do this alone. This is a program that has been 12 months in the making and 12 months in the planning. Today, we're here not only because of the dedication of our clinical teams and our leadership, but because of our philanthropic partners. The program, our workforce program, is called the Hunter Family Workforce Program. But please know, we have had multiple family foundations and granting partners join us, namely Omron, Astellas USA, the Foglia Family Foundation, and the Coleman Foundation, who funded us initially for this community health worker program when no one else understood or appreciated the power of community education. With all that being said, I want to once again thank all of you for your commitment and leadership and wanting to make a difference in our community. It is my distinct pleasure to introduce to you for the presentation today, once again, Willard Hunter and their Executive Director, Frank Biaggi. Thank you.
Thank you, Joseph. My name is Willard Hunter, and I'm a trustee of the Hunter Family Foundation. My brother is also a trustee, my parents, and then we also have a 3rd generation that's also part of the foundation, which we are growing in that regard. Initially, the Hunter Family Foundation was established, if you could hit the next slide, was established in 1993 by Maxine Morrison Hunter and Thomas Benton Hunter III, who are my parents. They're now in their 90s, and it was initiated as a private family foundation that is committed to honoring, supporting, and reflecting the values of the Hunter family through philanthropic giving. My parents started the foundation really with a bent towards community, and that was a community where they live and work, and now have retired. Early on with the foundation, it was more reactionary to people's needs in the community and who they were exposed to. But we hired an executive director, and we've grown what we're doing. We're doing some learning, and we also have but we still have this focus on Lake County and the Chicago area. Next slide. Now, our mission is to improve the lives in a long-term and sustainable way by supporting education, healthcare, economic development, and the environment, in communities where members of the Hunter family live, work, and have philanthropic interests. Next slide. This slide shows our different areas of focus, and this continues to change as we go upon our learning voyage. So, for instance, on this health care at one point was in 2017 was 17%, and now it's up to 23%. So you notice that. We also, you might take notice of workforce. That's an area that we're working with in the Lake County area. And you might also notice that in 2020 we stepped up and did a lot of work in the COVID response around, especially around food that was hard to find in Lake County. So next slide, please. Now, why workforce development? Originally, workforce development was something that was noticed in that it was hard to find workers, specifically even in the trades, HVAC, electricians, and things like that. And it seemed like this is a logical thing to work on, where there are lots of people that need work, and it would be logical to train those people. So it started there, and it's grown. So the Hunter Family Foundation believes that a robust and qualified workforce is core to the health and stability of a community. Focusing on supporting skill development and building economic opportunity benefits businesses, families, and individuals. And by supporting training and apprenticeships and making investments in the ongoing professional development of the existing workforce, we become a partner in efforts to decrease income and job inequality, which we know exists today. Frank, do you want to?
Yeah, thanks, Bill.
Yep.
Hi, everyone. I'm Frank Bayaki. It's great to join the JourneyCare community today and be with you, all of you. So we're proud to support the Hunter Family Foundation Workforce Development Initiative here at JourneyCare Foundation. As Bill was just mentioning, it helps bring people into the community, into new jobs, and provide support along those jobs. So kind of the continued supports to allow people to grow and advance in their work. And to partner authentically with community members and organizations. One of the things we've noticed with JourneyCare is its ability to be porous and reach out into the community and meet community needs. This doesn't exist behind four walls. It's really in membership and partnership with the community, which fosters a culture of learning that extends beyond the institution itself. You bringing in new ideas, new developments, as well as bring out to individuals new ways of working. This was especially evident in the pandemic as JourneyCare helped support other nurses and other healthcare professionals to be able to provide very challenging kind of end-of-life programming and support when people didn't have that kind of expertise, or it wasn't a part of their daily experience. And so that's helped them to lead transformation in the community and help them to build the capacity of many other organizations to be able to care for people during very difficult times in their lives. Next slide, please. So, right, so this partnership began as a more general grant, and we really learned from JourneyCare about the potential opportunities to develop its workforce, which led to the creation of this initiative. It was really an interrelated dialogue and a lot of exchange to understand what was needed to really bring people in authentically and give them the support and training that they needed to be successful. And we've taken these kinds of opportunities and met with other hospitals and community colleges and medical schools and clinics to find other ways to develop pathways for healthcare professions in Lake County and across the Chicago region. And next slide, please. And really, we're here mostly to say thank you to the community health workers you're about to hear from, the nurses, and all the JourneyCare staff members for your work to ensure people have access to the support and guidance that I've just mentioned, especially during some of the most difficult times in their lives. And we recognize that everyone's had a difficult time, including the JourneyCare staff themselves. And we really do honor and respect your work, care about it, and it's our pleasure to learn from and partner with all of you. Thanks, Joseph, for the opportunity for giving us a chance to speak too.
Willard, Frank, thank you very much. As Willard and Frank mentioned, this initiative started with an idea. We knew we had an issue within healthcare of retaining and growing nurses, CNAs, education amongst diverse populations around post-acute care, end of life. These were aspects that we understood were a need, and we didn't know, there was no playbook out there. We had to really develop one for ourselves. And as we were developing this program, we were lucky to be able to hire Dr. Ambrose, who is going to be talking to us in a second, as our director. Venancia brings experience not only as a practitioner, but also as an educator. She took the idea that the foundation board and the clinicians and our partners had and materialized it into a way that is impacting our community. One of the biggest things that we found out early on from our community health worker program, our education program, and our program with working with our community colleges is there were silos. Our philanthropists, community leaders, healthcare leaders, no one was really talking to each other about the issues that were facing the healthcare industry in the post-acute setting, but also the needs of our patients and families within various communities. So at this time, it is my pleasure to introduce Venancia to the dialogue and going to give us a background about our community health worker program and our workforce program. Venancia?
Yes, good afternoon, and thank you so very much. I'm Dr. Venancia Bate-Ambrush, Director of Workforce Development here at JourneyCare, and it's my pleasure to share with you the infrastructure of the program. I'd like to start off by talking about clinical education. We are educating the next generation of healthcare providers, whether they be CNAs, nurses, social workers, physician fellows, and physician residents. So those are the types of partnerships that we have with community colleges and universities to educate that next generation of healthcare providers in the post-acute care arena. We also offer community education. Much of the community education, which you'll hear later from the community health workers, are delivered by community health workers, but there are other types of community education that might require someone with a different type of clinical background that we have available at JourneyCare, be that bereavement, music thanatology, nursing, what have you. So we partner with all different disciplines and professions within JourneyCare to provide the community with the education that they need to make informed decisions about palliative care, hospice, and advanced directives, and so much more. And last but not least, I'd like to talk about the apprenticeship programs. Currently, we have 2 apprenticeship programs. The first is the CNA to RN Bridge program. We currently have 6 JourneyCare CNAs who have decided that they wanted to enrich themselves, their community, by going on for additional education to become a registered nurse. So in partnership with Harper Community College, those 6 initial CNAs are going through a cohort program in order to eventually earn their RN degree. So we're very pleased to offer them that economic and educational opportunity for growth. We also have the community health worker program, and we were very fortunate to receive funding from the Coleman Foundation to launch this program in 3 distinct areas of the city of Chicago. So on the west side of Chicago, serving the greater Lawndale area, we have Angelica Gomez. On the north side of Chicago, we have Maureen Burns serving the Rogers Park area. And on the south side of Chicago, we have Candace Straw, who is serving the Chatham community. And for those who are not familiar with what a community health worker is, they are trusted members of their community that serve as a bridge or a liaison between the community and the institutions intended to serve them. Because sometimes there is communication breakdown between providers, practitioners, and the general community. So CHWs, once again, being able to speak the language of both healthcare and the communities where they live, provide this very important service in addition to providing community education on advanced directives, palliative care, and hospice. This is not a new concept. It's relatively new in the US, but I would like to let you know that across the world, this is a model that has been utilized on every continent. So in Eastern Europe, they were called Feldishers. In China, they were called barefoot doctors. And in Spanish-speaking countries, particularly across Latin America, they were called promotores or promotoras de salud. So without further ado, I turn it back over to you, Joe, to introduce our wonderful community health workers.
So usually you don't want to go after Venancia. So I am going to go in between our community health workers and Venancia. Thank you, Venancia. It's been a pleasure working with her for what she's been able to do with this program in the last year to build out the infrastructure of what we had an idea for, the gaps that we knew we had in our communities, and to build out not only the community health worker program, our apprentice model, but also the education components. As Venancia indicated, we have three of them, our three community health workers here today, Angelica, Maureen, and Candace. I'm going to ask Candace to go first, but when they're introducing themselves, one of the questions I'm going to ask each of them to tell us is, why are they attracted to this profession? And after all three ladies introduce themselves, we do have a series of questions that we're going to ask the panelists and get into the discussion of what is the program, what are we trying to accomplish, and the impact and the tracking of this initiative. So again, thank you once again, Venancia, and Candace, I'll introduce you first.
Good afternoon, everyone. Thank you. My name is Candace Straw. I am the community health worker for the Chatham area, south side of Chicago. I am a writer and a cancer advocate, a national cancer advocate as well for the Ovarian Cancer Research Alliance. I also sit on two associate boards. I sit on the Gilda's Club Chicago Associate Board and also the AIDS Foundation of Chicago Associate Board. Two boards that are very dear to my heart and part of my advocacy work. Community health work is important in colored communities, but also what attracted me to community health work was the fact that once I do a lot of volunteer work. I started that out before I got really settled in my career, and I began to see what the needs were in the community, the food insecurities, the lack of health care, the lack of resources. And I began to see how important advocacy work is. And a community health worker does a lot of advocacy work, and it's something that I really enjoy. It's something that I'm good at and something that's really, really needed. So that's what attracted me to this work.
Thank you, Candace. Next, I'd like Maureen to introduce herself and tell us what attracted her to this profession.
Hi, good afternoon, everyone. So my name is Maureen, and as mentioned, I'm the community health worker for the Rogers Park, Westridge area. My background professionally prior to this was in pharmacy, community-based pharmacies, and hospice mail order pharmacy. So I had a healthcare background, but I really didn't feel like I was making an impact or affecting change the way that I wanted to. I've always been really attracted to social justice movements and equity in healthcare. So when I found out what a community health worker did, it really appealed to me because I've had those experiences. I've been in situations where I really could have used someone to sort of serve as a bridge between me and healthcare entities or social service entities. So I'm really excited that I get to do that now for my community in Rogers Park and Westridge. It's a very diverse community with a lot of rich cultures and many languages spoken. And we have a lot of resources, but things tend to be scattered. So people really do need that connection to sort of get them the services that they need. So I'm really blessed to be able to do that here with JourneyCare.
Thank you, Maureen. And lastly, Angelica, can you please tell us what attracted you to this profession and which region you serve?
Hi, good afternoon, everyone. I'm Angelica, or Angelica. I serve the greater Lawndale area on the west side of Chicago, which includes the neighborhoods of North Lawndale and South Lawndale, also known as Little Village or La Vita in Spanish. What attracted me to this work is because Professionally, I have a background in mental health, and I used to work at an outpatient recovery center. So I really did enjoy connecting our clients to resources in the community as they were reintegrating back into independent living. And what attracted me to this role is that I'd be able to do the same with the patients on our services, not only for the patients, but their families and the caregivers. I live in Little Village, and I've been volunteering for environmental justice causes, social justice causes, access to more mental health services in North Lawndale. And then throughout the whole pandemic, just the mutual aid collectives between North and South Lawndale, making sure our residents and neighbors have access to food, nutritious food, not just any type of food, but nutritious food. And then affordable housing, and also helping undocumented families or mixed status families access resources as well. So that's what I really like, being an advocate for others and then showing others. We do have a lot of hidden gems in North and South Lawndale that maybe community residents, maybe they just moved into the neighborhood, or they've been here for a long time, but they're maybe not aware. So I really enjoy learning about what our communities offer through various ways in outreach, and then also through social media. There's a lot of great things going on here in North and South Lawndale. Thank you.
Thank you, ladies. The first question that I'm going to propose to the three of you, and you can all answer, or just one of you. This has been asked a few times by a few of our participants. How does, or what is in concept or in theory, the relationship between a community health worker and our integrated care teams? So for those of you on the line, the integrated care team surrounds the family and patients in hospice at the end of life. So you're working with our CNAs, our doctors, social workers, chaplains, and so forth. What is the relationship between you as a community health worker and the integrated care team in navigating healthcare for our patients and families?
So I can start. The three of us are each assigned to one team, interdisciplinary team for current JourneyCare patients and their families. And that's based off geographical area. So I'm assigned to a team that serves my area, and Angelica and Candace to other teams that serve their areas. So everyone gets together on those meetings, like you mentioned, nurses, social workers, chaplains, doctors, and us too as the CHWs. So basically, if someone on the team identifies a patient or that patient's loved ones, family members, that has a need that's outside of the traditional scope of hospice. So maybe they're struggling with food insecurity, or maybe someone in the household lost their job and they need help getting a new job. Things of this nature, that's then referred to us. And we hope that, through our connections with our communities, we're aware of services right there in the area that we can connect the patient or their family to.
Angelica or Candace, any comments or additions to Maureen's?
So most recently, sitting on our IDT teams, there have been concerns about housing for some of our families. Also, we've had some families that have needed resources for food, or maybe stuff outside of the normal JourneyCare, like bereavement services, things like that. So that's been the most prevalent thing so far that we've had on our team. It's been a lot of housing insecurity issues. So, as a community health worker, my responsibility, is to point that family, the particular family who may be in need of certain resources, where they can go, or just in general showing them where housing resources are and just pointing them in the right direction.
Yeah, and it seems like, when people think of healthcare, they think of going to the hospital or doctor, addressing the ailment, and then going back home. The role that you three ladies at Venancia have brought up, it's more of a holistic approach. Because if you don't have a home to go back to, how are you going to get healthy? Or if you don't have the proper nutrition, which we have seen that pop up a couple of times. Mr. Willer Hunter brought it up as that's something that their family foundation is looking at, is that food, the disparity there. I believe, Maureen, you brought this up earlier, that healthcare has a scattered, you're trying to collaborate and bring all the resources together so it's not in a scattered manner. What do you mean by that? Can you explain that a little bit more?
I guess I mean that, I think it's correct and good that many of the best programs and the services offered are not, they're not under one roof with four walls, and they're not necessarily administered by the government. They're using, community partners, people who know these areas and know the needs of the residents. And that's the way it should be. But because of that, you have a lot of, small different sites offering different services. And for your average person, that's worried about paying bills, putting food on the table, and for our clients, they're in a really vulnerable time taking care of someone who is dying. It can be very hard to figure out what's available to you, what's there, and how to access it. So it's really nice that we, as the community health workers, are able to sort of help them navigate that and point them in the right direction or connect them, because a lot of people just really aren't aware of what's available to them.
So thank you, Maureen. The next question I'm gonna ask is for either Willard or Frank. You're philanthropists, you're people that wanna make a difference in your community, in the region. Nobody predicted COVID, nobody understood the impact that it's gonna have, yet you still want to affect change. When you see a program like this, and it's a new program, we were building infrastructure, Willard, when we first met you. We didn't have all the I's dotted and T's crossed. What are some things that give you hope or comfort when you see a new proposal, new idea like this, that you're willing to take a chance on the impact of change when it's not completely built out? And or conversely, what are some of the results that you feel comfortable? It might not be the tangible results that you see on a piece of paper, but the impact can be felt differently. So Frank or Willard, I'll just leave it open to either of you to answer that, or I'll take it in any direction there.
Frank, do you want to take that?
Sure, I'll take it, and then please follow up as you would like. So a couple things. I mean, I think that we're really interested in this understanding of how organizations are rooted in community and building from authentic needs in the community. And as Maureen and Candace and Angelica have said, this is, there isn't any one need. There's multiple needs, and they can actually, these are the social determinants of health, right? So we're talking about food insecurity and housing insecurity and other areas that, we know housing is health. Having nutritious food is health. And so it's identifying kind of how an organization is interacting with the community, meeting its authentic needs, and meeting people where they are. And that's what community health workers do almost better than anybody else. I mean, in my mind, what we've been able to see community health workers engage in the past couple years include things like the census and voting rights and COVID-19 vaccination access and testing access as well. And so, I mean, that helps people stay healthy, both mentally and physically. Those policies that come because of how the census is filled out are critical to every individual's lives. And so it's that deep understanding of the community we think that's most critical. And so we understand that when an organization comes to us initially, if it can kind of demonstrate its commitment to the community and its understanding of the community's needs, and that all of this kind of really builds from authentic relationships, we're interested in helping to try to support that. Bill, anything to add?
Yes, I would say, 3 or 5 years ago, these types of programs, foundations would have waited for the program to come together and all the individual pieces put in place. We would have had a very specific outline of what we were supporting. And at this time, especially during COVID, we recognize that these things aren't going to come into place, and we need to be a partner. We need to be somebody who's supporting this, and maybe even brings together some of the ideas. And we're going to look at granting money to an organization without some of these restrictions, because the idea is to move ahead quickly, and over time these kind of the structure and the what needs to happen does come together. So it's that's one good thing about COVID, is it sort of pushed philanthropy into areas where we can't afford to wait, and we need to make an impact right away.
Thank you, Frank, and thank you, Willard. Financia, this question is for you. You acknowledge that you've been an expert in this field. You've been in this field for quite some time. You've seen the evolution, and you've pushed the evolution. If somebody is new or is hearing of a community health worker for the first time, what would be your advice to he or she about going into this type of work, either at a early in their career, a mid-career change, or somebody that just wants to continue to be a force for change for one's community?
Thanks, Joe. That's a fantastic question. I began my career in healthcare as a community health worker and wouldn't be a community health psychologist today had it not been for that foundation as being a community health worker. So at the time, I didn't have the luxury of knowing that such a position actually existed, because they weren't titled community health worker. There's lots of different titles that they can operate out of. But it wasn't until I happened upon the Chicago CHW local network that I actually learned that this is a viable profession, that you can pivot in many different directions. It's such a broad field, and there's opportunity for growth within the field. And so it was through my work with the Chicago CHW local network, which later became the Illinois CHW Alliance, and then working across the country with the American Public Health Association, that I learned about the fantastic work of CHWs. So my advice would be research and find out if there's a local network or coalition of community health workers in your area, because it's important to have that peer support and to learn from others who have been in the field a little bit longer. I would also say, when you're looking for an employer, it's just as important that you interview them as they interview you. So find out if it's a good fit for you. Find out if, when you say community health worker, if they're talking about the same thing, because sometimes employers will say CHW, but then the work is really not as community focused as you might hope. So again, I would say connectivity is really important, connecting with other CHWs and CHW leaders.
Thank you, Francia. Candace, Maureen, or Angelica, what has been one of the bright spots or aha moments for you during your studies during this process? Because, correct me if I'm wrong, you work a regular 9-to-5 type of job for JourneyCare, but then you also go to school. In your curriculum right now for your classification, what has been one of those learned opportunities in the classroom that has really made you proud to be in the work, or there's a skill set that you've learned, or is there something that you now see a different way of the discipline changing and something that may attract you differently that may not have 3 or 4 years ago? Either of you ladies?
Yeah, I can start. So yes, we're almost done. We'll be done in May with our basic certificate for CHW program at Malcolm X. And what's really been an aha moment is that we're taking epidemiology as one of our courses, and just how much impact community health workers have on public health, and bringing awareness about different types of health services to different communities, and that they're culturally available and in the language that the residents need. So that's been a really aha moment for me. And then being able to learn how to engage with community residents and come up with a plan to instill or to start or begin even behavior change. So that's what's helped me in my community outreach with JourneyCare, is that some people haven't heard about JourneyCare or may not know or understand what hospice and palliative care is. Maybe they're from another country, and hospice and palliative care looks a lot different from where they're from. So then educating on what hospice and palliative care looks like here in Chicago, or and what it looks like as far as their options the family's options and the patient's options as well. That's been really helpful.
I'm sorry, Maureen or Candace, any comments to that or additions?
So I would echo Angelica when she talks about our epidemiology class and our studies, but also learning about the importance of community and mental health. Also bridging the gap, but also building relationships, and how vitally important that is when it comes to your role as a community health worker and when you're dealing with someone from the community. That it does take time to build relationships, but that also there are many individuals that are economically challenged that may not have the money, the resources, don't understand what it is. Also, the mistrust that happens between the healthcare worker and a community and the community health worker, and how, you know, I would be that person to come in and to make changes and convince the person that is needing help or services, you know, that it's okay, and that, you know, we're going to come up with a plan. Things like that. Mental health is something that is not easily diagnosed in Black communities, something that is very difficult. So I've learned in my studies, in my mental health class, about how to deal with things like that, how to communicate. And so that's, for me, that's been one of the more valuable things that I've learned this semester.
Thank you. Candace, I'm going to keep you on center stage real quick. You've acknowledged your passion and the commitment you have, not only for this type of work, but also for the cancer area. You've done a lot of work with cancer patients and cancer awareness. What is the relationship or correlation or a way that we're going to try to bridge the research that's being done, the patients that are diagnosed with cancer, along with knowledge or access to care with end of life through your profession? Like, how do you see the community health worker being that bridge for either the cancer aspect of it or the end of life aspect of it?
I think in our trainings, we did partner with Wellness House, and we've been able to learn a lot more. Like, I'm not the expert on all types of cancer, but I have learned a lot more than, say, maybe, you know, a lay person in the community. So even knowing that I can reach out to that resource, the Wellness House, to maybe learn more, or even refer our patients or the families or the caregivers to Wellness House as well, has been really helpful in my role of connecting services.
Okay, thank you. For any of our panelists, give me, you know, what has been a quote unquote win? What has been a moment that you're very proud of, that we have this program in place for our community, our families, and our patients? I know it's an early, this program is off to an, you know, it's very young and it's in its infancy of an operation, but what has been something that you've been proud to be a part of now we have this community health worker program? And I open this up to any of you.
When I have done outreach work, I have noticed that most people are grateful for the information. Again, a lot of people don't know the difference between hospice and palliative care. A lot of people don't know what JourneyCare is. So it's been a lot of communicating, saying what the organization is, but also having people know that, you know, there's a difference, how it's important to talk about end of life issues, and how it's important to prepare for end of life issues. So usually I have a couple of people who I've talked to that really are surprised by how much I knew about hospice or palliative care, or that there was even a difference, or that this is something that could benefit them. And then knowing about a lot of individuals in my community don't know about advanced records, don't know about what a 5 wishes document is, are not used to planning for end of life issues. So when you bring that up, you know, a lot of times I get, well, this is not easy to talk about. Well, no, it's not, but it is necessary. And, you know, when you deal with certain people who will say to you that, you well, I don't, want anybody telling me what to do. I've always said that it's my job to bring you education so that you can make an informed decision about your life and and make a decision that's best for your family.
Maureen, go ahead.
Yeah, I would just add to what Candace said that, I feel like every day doing this work that I am making a difference, but it really comes through when you interact with people in the community and they actually really express gratitude and let you know how you made a difference for them. So that's really been the best moments for me. I did a presentation on the 5 wishes, which is a type of advanced directive that we really recommend for all adults, regardless of their health circumstance. And we had a participant on there who let me know afterwards that, she participated because she really did think it was important to do, but that she had a lot of anxiety about it. And she was really uncomfortable, thinking about end of life issues. And she let me know that, the way I spoke about it engaged the audience. It really put her at ease, and she was really feeling a lot better about doing this. So things like that, when people actually tell you, yes, this really made a difference for me, I don't really think there's anything better for us as community health workers, because that's our goal.
Well, and that leads me to another question, Maureen. And you're in the community, you're making an impact for the community. What are some of the programs that you would expect to be in place that we need to start as a healthcare entity, start focusing in on? Because early on, it was as simple as having our literature in multiple languages. That was something that, we didn't have readily available. And when you ladies were going out, you would come back and, for me, I was like, well, this should have been done, type of thing. It's like, these are little things that, we're going to just have to be a little bit more aggressive with. What are some of the things early on that you're starting to see that you're going to be able to bring back to grow and to make a more positive impact so that JourneyCare can continue to be that resource?
Yeah, so I'm sorry, go ahead, Angelica.
No, go ahead, Anna.
Oh yeah, I agree with having our brochures and flyers in multiple languages, but also to hire more CHWs, because I have gotten a lot of requests out of that's not particular to the greater Lawndale area, and for a Spanish, a presentation in Spanish, and they're like, oh, I saw you give a presentation for this network, can you also come and present but I live over here. And I'm like, oh, that's out of my area, but I can ask my supervisor. And so yeah, just like once I got the ball rolling and then started giving presentations, and then people were like, wow, like I never knew about this. Or they're like, I didn't really want to talk about it, but the way that you present it, you really, like Maureen said, like you really calmed my anxiety. And because we've given joint presentations together, and then we really want to start out by thanking the community, the audience, for being brave enough to start talking about this, start thinking about it. We always give our email, our phone numbers, so if they have any questions, or even if they just want to talk about it more, or even say, hey, like I didn't fill it out yet, but I'm still thinking about it, things like that. Like that's what that's what I really enjoy, and then think that to get this program even further rolling, like down to the future, is to hire more, so that we'd be able to cover more ground in all the counties that JourneyCare serves.
Frank, I have a question for you. You've been a respected and well-known leader amongst the foundations and family foundations for quite some time. Have you seen collaboration amongst foundations increase over time, decrease? And if so, what is the best thing you can tell foundations that are wanting to cross over? Because right now, when you're thinking of food deserts, or if you're thinking of housing issues, you don't think palliative care, hospice care. Yeah, we're starting to see collaboration across disciplines. What are some thoughts that you've seen over the time as an executive?
It's a great question. I know there's some others on this Zoom that would be able to answer as well, Shelley Davis from the Coleman Foundation and others. But let me just say, yes, increasingly funders are coming together to identify ways to build stronger public-private partnerships that ensure that these kind of comprehensive care can be provided. We're looking across sectors. We're looking deep within innovation within certain sectors. It's very interesting when you can borrow from the health sector to inform the education sector, or legal services to inform the environment. And so more and more often, funders are coming together and recognizing, who do we need in the room to solve these complex social problems that exist? You know, as we mentioned before, and as our community health workers have mentioned, these social determinants of health. We need the housing, we need the food, we need the access to a good job, a high quality education. These are the things that are needed. And so to have someone in your life, like a community health worker, that can pull that all together is so wonderful at the ground level with individuals and families and community members. Now let's go back upstream to the system and say, what do we need to fix at the system level to reduce the barriers that we see across those sectors, to ensure that everyone has access, to improve the social safety net. And so different perspectives bring different kinds of expertise, can bring different kinds of solutions to some very entrenched problems that without each other, we're not going to solve alone. And I think it became very clear in the pandemic. In the pandemic, Chicago and local funders were very quick to respond and very thoughtfully. But part of the reason that was because they had already started to build those kinds of relationships and say, I know I can't do this, or I'm not sure I understand this area, but I know these funders, these leaders, these community health workers that can tell me about it and inform me and inform my grant, make it more impactful.
Thank you, Frank. Venantia, I'm going to ask you a question. You hired these three ladies. You've hired many employees over your time. What is the one or two characteristics that you think separate a committed community health worker that wants to make a difference to somebody that's using it as a paycheck or an opportunity to gain some knowledge? What do you think are those key characteristics?
Thanks, Joe. I believe that if you're entering the profession, and it is a profession, it's a vocation, it's a calling. If you're entering the work, you have the calling. You have a spirit of service. These are servant leaders that, have been leaders in their communities, have been leaders, on their block or in other, volunteer opportunities. And so they're translating all that knowledge that they have and giving back to the community. So their first concern really is that their patient or their community members are accessing the services that they need. And more than just accessing service, they're social change agents. They're actually making foundational change in these communities by showing what this opportunity has to offer others who might think, well, I didn't think I could do it, but I saw Maureen, I saw Candace, I saw Angelica, I know them. I think I can do that too. So they're also role models in the community. Recently, Angelica spoke at a grammar school and had lots of questions from grammar school students who didn't even realize that CHW was a thing. So again, I think it's that servant leadership, that spirit of giving back to the community, that spirit of advocacy, because it's not easy being a community health worker. Sometimes you have to call out some difficult things, either to your employer or to your neighborhood or patients. And so you have to have that courage to be able to be that good advocate and to step up for what you know is right. So it really is more than just healthcare. It's social justice in action.
Thank you. With that being said, are there any final comments before we begin to conclude today's Lunch and Learn from any of our panelists? Okay. I just want to say once again, thank you, Willard, to the Hunter Family Foundation, to Frank. Your leadership early on, along with the Coleman Foundation, who took our proposal and helped us refine it for the community health worker program, allowed us to build out a program to affect change and to make a difference and to promote end of life and have those conversations. So Willard and Frank, to the rest of the family, Hunter family, thank you. To the others, the Coleman Foundation, the Foglia Foundation, Astellas USA, Omron, I want to say thank you. Taking a chance on something that is in its infancy and being built out is sometimes difficult, but the rewards are great. And today we have a program that is thriving and we're looking to expand it. I believe Angelica said you want more community health workers. I'm not arguing with Angelica. This is something that we can see as an impact. And at JourneyCare and the JourneyCare Foundation, we want to be a part of changing the conversation, making sure that people are able to have the tough conversation around end of life, but also all the factors around healthcare. To all of our board members, philanthropists, and community partners, thank you for your unwavering support. We got through 2020 together as a family. We helped each other, we were there for each other, and we could not be more grateful to you. Because every day our clinicians and our clinical teams are serving our patients and families, even through the pandemic and everything that our city and region went through last year. Our clinicians and partners were out there making sure that they know JourneyCare was there for them. So on behalf of the JourneyCare Foundation, our boards, and our community, I want to say thank you to all of you. Please fill out the responses because we want to hear from you. We want to know what our next topic will be and who you think we should invite to be a part of it. Until then, thank you very much for your support and have a great afternoon. Thank you.
Thank you.